Thank you, Assemblymember Gatto, and thank you to all the committee members for your deep thought and analysis into this bill, for your thoughtful questions, and for the robust debate. I also thank you, Assemblymember Gatto, for your flexibility and your openness to a different approach to perhaps get a stronger bill that still achieves your goals but accommodates some of the concerns that were raised today. So I just want you to know that if we do park the bill here, as you stated, we're hitting some deadlines, so it may be a 2-year bill and not a bill that can actually continue to move this year. And if we do have if a member who moved the bill is willing to withdraw the motion.
Yes, but on the 2-year bill front, I think we have some type of idea of where things could go, and if we get those in by next week, are we pushing up against the deadlines, or it's my understanding that we still could.
We do have hearings up until the 28th.
Okay, because I would not want to burden Mr. Gomez and the next committee. So,
for the record, I think Assemblymember Gomez's committee can do excellent policy work.
All fiscal is policy. I guess the question is, do we need to notice reconsideration if we park the bill? That's another procedural question that I would have that I don't know the answer to.
Reconsideration has to fail for reconsideration.
That's only if it fails, right? Yeah. Okay.
I think the motion for consideration is only appropriate after there's been a vote and it doesn't have enough votes to pass. And if the Assembly member from Los Angeles is willing to withdraw the motion.
Yes, please do withdraw, and then we'll have some more time to work on it. And,
okay, the motion is officially withdrawn.
Terrific.
Okay, thank you, committee members.
Thank you very much. I look forward to doing some good policy that makes everybody happy.
Thank you,
very
sir.
Much.
Thank you. Okay, we're taking a moment here to lift the call. On AB 775, item number 14. Madam Secretary, please call the roll.
Mainshine, no. Bonilla? Bonilla, aye. Gomez?
We're lifting the call on AB 775, Assembly Members Chu and Burke.
Gomez, aye. Gonzalez? Gonzalez, aye. Hernandez? Nazarian? Nazarian, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Santiago? Steinnorth? 11-5. It passes.
The vote is 11-5. That bill passes. We're also going to lift the call on items number 8 and 10. Item number 8 is AB 461, Assembly Member Mullen. Madam Secretary, please call the roll of absent members.
Bonilla? Bonilla, aye. Gomez? Aye. Gomez, aye. Gonzalez? Aye. Gonzalez, aye. Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Aye. Nazarian, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Santiago? Steinnorth? Waldron? It's 15-0.
The bill passes 15-0. Next is item number 10, AB 572. Madam Secretary, please call the roll.
Bonilla? Aye. Bonilla, aye. Chavez? Chu?
Aye.
Chu, aye. Gomez? Aye. Gomez, aye. Hernandez? Nazarian? Aye. Nazarian, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Santiago? Aye. Santiago, aye. Steinnorth? Thurman? Aye. Thurman, aye. Waldron? 15-0.
The bill passes 15-0. Assemblymember Eggman, thank you for your patience. My apologies for the inconvenience. You have two bills, AB 1193 and AB 1194. Please proceed with AB 1193 when you're ready.
Good afternoon at the end of a long committee meeting that I hope will go quickly now. Thank you for taking the time to hear this today, Mr. Chair and members. Today I'm presenting two bills. The first one is 1193. My talking points just went away. It's dealing with a law called Laura's Law, otherwise known as assisted outpatient treatment. It's an evidence-based treatment program that in certain circumstances provides treatment to those who have a severe mental illness. There are many criteria that must be met before a person with a mental illness may qualify for AOT, including in danger to themselves or others, and multiple hospitalizations due to mental health issues. The purpose of AOT is to keep people with severe mental illness in the community and in the least restrictive environment by providing additional support, by supporting someone so that they may remain in the community. We don't think that threatens anybody's civil rights because it is much better than oftentimes being hospitalized and or incarcerated. Since its passage, AOT has been implemented in 9 counties across the state of California, and this bill will encourage more counties to implement AOT but will not require that. So currently there is a continuum of mental health issues, the most non-restrictive, of course, just being voluntary outpatient. There is an intermediary where it is much more intensive. And then, of course, sometimes people have to be 5150 and or hospitalized and or put into a conservatorship. This, we think, is a step before somebody has to be hospitalized, assisted outpatient, which can be then court-ordered. And we see more and more family suffering, patient suffering, and I often use the analogy. Oftentimes, a mental illness itself will tell people, "I don't need any help. I'm okay." And to me, it's somewhat analogous to someone having a leg cut off after a traffic accident and saying, "No, I'm okay. I'm okay. Just leave me here." So we think this is an evidence-based treatment program. It was based off a law, Kendra's law in the state of New York, that has been in existence. It is strongly evidence-based. Duke University has done a big study on it. We see a reduction in hospitalizations, a reduction in self-harms when this goes into place. And again, this is based on a case in Nevada City some years back where a young woman was working in a treatment facility. Somebody came in, was not being compliant with meds, was not being compliant with treatments, and in fact ended up shooting and killing her. And this law then came in effect based on the New York law. Shortly after that, Nevada City, and now since then, 9 counties across the state have adopted it. When it was first implemented, it was optional. Counties had to opt in. And because it's been slow to be adopted, and we think it's a really good, we've got enough evidence now to know that it works, that we'd like counties to be able to opt out versus opt in. And even in that process of being able to opt out, at least people are having the conversation. Mental health issues are one of those things, and as a licensed clinical social worker, I certainly have been on the end of having to hospitalize people and providing a lot of treatment, and I think this is something that we don't talk about enough, and so we really hope this continues the conversation to provide a humane, evidence-based approach rather than hospitalization or oftentimes putting people in jail, because we all know a large demographic of our people now serving time in jails and in prison have issues with mental health issues, and we hope this provides a pathway to at least be able to bridge in between those two things. So we have a lot of witnesses here in support today, and I would respectfully ask your aye vote when it comes to that time.
Before we go to witnesses, as a courtesy to one of our colleagues and committee members, I'd like to go now to Assemblymember Bonilla to make a comment.
I just wanted to say I support your bill. Put in the request to be a co-author. I have to leave the hearing, but I just wanted to go on record as supporting the bill. We'll be voting for it in the future. Can't stay for the rest of the hearing today, but thank you for considering my request to be a co-author on this bill. Contra Costa County is a great example of a place where it's finally getting off the ground, but we need to get this going throughout the state. Thank you for this bill.
Thank you very much. I'm glad to add you as a co-author.
Thank you. Witnesses in support.
Mr. Chairman, I'm Randall Hager with the California Psychiatric Association, and we are the sponsors. I just wanted to acknowledge that Laura Wilcox's parents are here today with us, joining us here on the dais. I'm going to be starting off with a brief introduction. I have Dr. Daryl Quinn from Nevada County, who has a very successful program, been in operation for 7 years, is going to explain a little bit about that. And then we have Dr. Mark Sugarman from the Emergency Physicians Association in California, who's going to do a quick close about emergency room conditions. So I have the privilege of having been involved in the drafting of this. I'm aware that Laura's Law was developed out of a hearing that the Assembly Health Committee actually had in 1998 about criminalization of the severely mentally ill. It wasn't the first hearing. 1985, Assemblyman Bruce Bronson also had a hearing. And yet, here we are today still talking about the enormous number of people who are in our jails and prisons. As we speak, there are 150,000 people in this last year who have received their outpatient services in jails. There are another 25,000 who have received their outpatient services and sometimes inpatient services in our prisons. Laura's Law was meant to be an early intervention tool that interrupts the arc of a person towards committing an act which gets them arrested, which gets them hospitalized, which may hurt or harm themselves or others. It has worked very well in those locations who have implemented it, and it is evidence-based, as the Assembly member said. The Duke study was a seminal study. It was published in 1999. It said basically three things. You can help a group of people that doesn't really want help but obviously needs help because they're having a high impact on their communities in terms of adverse public health outcomes if you do three things. One is that you provide them with intensive services. A lot of people accept those voluntarily, and that's just great. But the other is that there's a need for structure, and a judge provides that. The third thing is that you need to give these people time to be treated and time to heal, and that's why we have a 6-month minimum in the law as it stands today. So that is kind of the background on this program, and I'm going to turn over to Dr. Quinn.
Thank you. Thank you for your time here. I'm the program manager. I'm Daryl Quinn, PhD. I'm a clinical psychologist. I've been at Nevada County for 14 years. I was there the day that Laura was killed. I was there the day that we implemented Laura's Law. I was the lead program manager for this service. We contracted with Turning Point, and we've been operating since May of 2008. We have 7 years of data. 7 years we have reduced psychiatric hospitalizations. 7 years we've reduced days of homelessness, and 7 years we've reduced incarceration. We've found that on average about 40% reduction in hospitalizations, 60% reduction in jail days, and 52% reduction in homeless days. I have known almost every single person we referred for Laura's Law because I've evaluated them in the jail, in psychiatric hospitals. I've evaluated them in what we call long-term locked care institutes of mental disease. These are individuals each time that when they went off their medications, they ended up in extreme distress and suffering, and as their family members also had to witness and experience a lot of that. And we have found this to be an extremely effective program. Thank you.
Additional witnesses in support? 2 minutes left.
Thank you. Good afternoon. My name is Tom Sugarman. I'm an emergency physician representing the California chapter of the American College of Emergency Physicians, and we support this bill. A couple things, and I'll tell you a brief story. We have a tremendous problem in California, just as the other speakers have discussed, with patients who have no access to care, who are not sick enough and do not properly belong in a hospital, who go through the revolving door of going in and out of the hospital and in and out of jail. And generally that door somewhere passes through the emergency department, and that's where I encounter these patients. And so while I respect that patients should not be hospitalized if they don't need to be hospitalized, that's the whole point of this bill, is to get them the level of care they do need so they don't end up going to jail or going to a hospital that's not necessary. And I have heard from some family members that they feel like their family members have the right to get better and the right to get treated, and they don't recognize as part, because of their psychiatric disease, that they have a disease. And so it's really incumbent upon us as their community to try to take care of them. A brief story about a patient that I took care of for many years intermittently at an emergency department in Alameda. He would come in repeatedly, either to be cleared so he could go to jail because he was under arrest for some petty crime, or because he was having a breakdown from schizophrenia, and then we would transfer him to the psychiatric hospital. And he'd be treated for a few days, then he'd be discharged, and this cycle would go on and on and on. And I don't think we were doing him any favors by not getting him the treatment that he really needed, which was assistance and help in taking his medications, going through ongoing therapy. The end of the story, which I don't know personally, but what I've heard, is that eventually he got so diseased that he got placed on a conservatorship, so he lost even more of his rights, and now is actually doing much better and is relatively happy. But the idea that we should tell people that because you have a disease and don't understand what's going on, you have the right and you should be able to refuse all treatment makes no sense. We have an obligation as a society, and our family members and our communities have a right, and the patients have a right to get better, and this is a way to do that. Thank you.
Thank you. Additional witnesses in support.
Mr. Chairman and members, Tim Shannon, representing the California Association of Marriage and Family Therapists, and we support this bill and urge your aye vote.
Additional witnesses in support. Please state your name, organization, and position only.
I'm Amanda Wilcox, Laura's mother. I've also been authorized to voice the support of the National Association of Social Workers California chapter. They're in strong support of the bill.
Please feel free to say more if you had more prepared. But you don't have to.
I will just say one line, which is that the outcomes of Laura's law in Nevada County is better than my husband and I had ever envisioned in terms of how much it has helped people save lives and save money.
Thank you. Additional witnesses in support.
Nick Wilcox. I'm Laura's father. It was almost exactly 14 years ago to the day that we sat at this table before Darrell Steinberg's Judiciary Committee and had the first hearing on this. It's been a long road. There's been a lot of evolution. I think we have finally come to the right place and found the right balance, and I urge your aye vote.
Thank you. Additional witnesses in support.
Judy Wolin with California Hospital Association in support.
Thank you.
Douglas Dunn. Douglas Dunn, Nami Contra Costa, strong support.
Justin Peterson, citizen of Alameda County, in strong support.
Marianne Bernard, mother of a severely mentally ill California man, former counsel to state mental hospitals in another state, and here to voice strong support on behalf of mentalillnesspolicy.org, a national policymaking organization providing information about severe mental illness.